And inside, there's stress too, as health workers scramble to reduce daily deaths while the national infection rate climbs. There are 85 children in this one ward alone.
Changing weather patterns driven by human activity and the burning of fossil fuels is contributing to record numbers of cholera outbreaks.
El Nino could not have come at a worse time. It is affecting countries like Lesotho, Mozambique, Zimbabwe, Madagascar, Malawi, and even Zambia.
My name is Theophilus Chuma, an investigative journalist working in Zimbabwe. Over the past 3 months, I have focused on the impact of the El Nino weather phenomenon on the health of children in Southern Africa. Madagascar, one among Southern African nations most vulnerable to climate change. Devastating cyclones such as Cyclone Idai in 2019 and Cyclone Freddy in 2022 have all originated from Madagascar, leaving a trail of destruction on infrastructure and agricultural outputs. The consequences on the health of children have been huge. Stunted growth and malnutrition that has affected close to 500,000 children in Madagascar. Projections from the Integrated Food Security Phase Classification IPC states between June of 2023 and April 2024, the acute malnutrition situation in Madagascar is likely to worsen significantly. Approximately 458,700 children under the age of 5 are likely to suffer acute malnutrition. Among them, over 121,000 children are expected to suffer from severe acute malnutrition, and nearly 338,000 children are expected to experience moderate acute malnutrition. The districts to be most severely affected are Nosy, Varika, and Ikongo in Grand Sud East, as well as Ambosari, Betroka, Bitioki, and Biloha in Grand Sud.
When nutrition levels are not good, a child's development is compromised. The cognitive ability of a child to develop into a full able-bodied human being is adversely compromised if they're malnourished. So we need the right nutrition at the right time so that we can have an able-bodied human being in the future. The cognitive development, how their brains develop, they are going to miss out on certain stages of development at key stages of the growth of a child. So this is where we are most concerned, because we need really to give the right nutrition at the right time. We need to be feeding children the right food at the right time.
Yet it's not only in Madagascar where children are at risk. Mozambique also faces this dark reality. An assessment conducted by the Integrated Food Security Phase Classification, IPC, on 66 districts in the 11 provinces of Mozambique that suffered shocks, it is estimated that around 210,000 children aged between 6 and 59 months are suffering and could suffer from acute malnutrition in the 12 months from May 2023 to March 2024. This a burden to a nation still to recover from Tropical Storm Freddy that affected cassava, rice, and sweet potato harvests. On this documentary, I work with Collins Mutita, a journalist based in Malawi. He tells me the devastating effects of Cyclone Freddy has prompted vector-borne diseases such as malaria, as well as the deadly diarrheal infection, cholera.
We are having an increase in diseases, diarrhea, even household levels. We have an increase in waterborne diseases, cholera, and also shortage of food. I think in rural areas the rainfall patterns have been altered. You remember previously they would know that this time the rains are coming. But this has been covered with also deforestation, erosion, we have flash floods, houses are being destroyed in Malawi. I think, of course, cyclone flood. The impact was exacerbated because people are not taking mitigation measures, but flash floods are always the talk of the day. So basically, I think Malawi is not left out of this talk of climate change.
In the last 8 years, since the El Nino weather occurrence affected Southern Africa, the region has continued to experience drastic weather changes that have resulted to flooding and intense heat, threatening food security for the region and exposing millions to hunger. Lessons from the 2016 El Nino highlight the huge risk that come with the changing weather pattern, as agencies noted the phenomenon severely reduced seasonal rains and higher than normal temperatures linked to El Nino caused an estimated 12% drop in aggregate cereal production. 8 years on, Southern Africa once again faces the reality of intense drought and flooding. The impact on agricultural yields is almost predictable, but there is another danger that could affect generations: distressed nutritional status for children under 5 years and young girls who may be forced into transactional sex.
Changing weather patterns driven by human activity and the burning of fossil fuels is contributing to record numbers of cholera outbreaks. And our warming planet is expanding the range of mosquitoes which carry dangerous pathogens like dengue, chikungunya, Zika, and yellow fever into places that have never dealt with them before. The climate crisis is a health crisis.
A groundbreaking research released on the 5th of December 2023 exposed the epidemics fueled by climate change across the world and the severe implications they have on the most vulnerable communities. The Climate, Amplified Disease and Epidemics Climate Report, titled How Epidemics Are Being Amplified by Climate Change, carries evidence linking climate change to the rapid increase in disease outbreaks and epidemics. Cholera, malaria, and dengue fever, and the recently discovered chikungunya virus are among the epidemics that have seriously exposed children, according to insights from health experts. Zambia, for example, is battling with its worst cholera outbreak that has killed over 400 people, while affecting at least 10,000 people since the outbreak was reported in October 2023.
A daily crowd anxiously gathers in front of Zambia's national football stadium, not for the results of a match, but for any news of their loved ones being treated inside for cholera, a known killer in these parts. And inside there's stress too, as health workers scramble to reduce daily deaths while the national infection rate climbs. There are 85 children in this one ward alone.
Dr. Elipilius Chibwaya is a public health officer with the Zambia National Public Health Institute and says the intensity of diarrhea cases is testimony to the risk Africa faces due to climate change.
Climate change, it is no longer a myth. Climate change is a big problem globally, and Zambia is also among the countries affected by the climate change. How does it affect our sector, especially in the health sector? When you look at climate, everything survives and thrives under certain conditions. When you look at changes in temperature, changes in rainfall patterns, looking at these temperatures, they are also coming with risk of diarrheal diseases. We see emergence of diarrheal diseases almost every year. Why? Because temperatures are high. Some of the microorganisms can thrive more in these temperatures. So it is a serious problem which even us as Africans need to take seriously, invest in ensuring that we protect our world and our environment. And what we give to the environment ultimately is going to give back to us by ensuring that there is safety and there is good health.
But cholera is just but one of the many disasters facing children in Zambia. In Zimbabwe, El Nino has delayed rains, meaning most farmers who depend on rain-fed agriculture will not be able to realize meaningful harvest. Edward Sewindi is a communal farmer in this area. He says this year may be worse than experienced in the last El Nino period of 2016.
Rolima ngabo December zoswa zothenga du. So zineri doba renew futhi mrawo. Azathumela phasi. So rolindelo riyana thangu zidobva. Kana zidophume hanta lunduso koitela uri maybe thangu zidotenda kana zidohana. Ari bulemeni ngamanda. Ribulemeni uri hayi rikosko chuwela uri rikosko vongela uri mvula yona zvifuwo zvidophila. Mara vathu ari kadzivana buleme buhulu ngamanda. Vurani ngamanda ngori hayi. Thangu zidoita mara angulavelesa one hayi. Mbeu dzawo dzikolamba ubva pasi. Zikutolamba vukuma. Zikobva mara zikodiwa ngaduwa. Ziyazomara usibva duwa likutanganidza. So arina plan.
Yet his fear is not only for his crop, but the health of his children as they are now forced to ration their daily food requirements.
So atiri ngombona rindo yani. Ndi situation yori na nendo rali ne muthu ndinopanda. Atiri ngobona rindo toita. Ndonda ngori atili. Ndila rutinga du. Ubva macheloni mpaka nya ndidola ndichivolala nga ndava yo budget. Na vana still ndizvezvo. Bana vadoila madhekwana. Ubva macheloni so votuwa chikoloni. Vakoda vadolindela vachidhapa avalichitu. Vadova yola madhekwana vachivolala. Achivwapo kutuwa chikoloni oraro angola kana saini. Mungona chugela hana. Ndorali sani atina kana chugele nori vatuwe vonwa nga macheloni vachia chikoloni. Utwa obanda nga madhi mpaka achaise. The whole day asungola chitu.
As predictions of huge grain deficits spread across many southern African nations, the nutritional status of children is also in the red zone.
Mwa auna pula ori ria budgeta nelijo. Drought vile ikanova hona pula yasanere. Rekano gwariso masimon restasi. Pula alisa una mwa ukanova ni drought ya ori vana vakanova nelikwashe karula hona aswa right. Babo budgeta ula. Muthu akapakela thapa mahasala.
Siboniso Chigova is the program officer at the Food and Nutrition Council in Zimbabwe. She says despite low prevalence of wasting, chronic malnutrition and micronutrient deficiency continue to be the huge concern among children under the age of 5 years.
What we used to know as wasting, where the body muscle is wasted in order to survive. So we see children's body being too small for their age, and this might be one of the indicators that we might see increasing. And also where the children are getting same type of food, mainly staples, we might even end up where we have kwashiorkor cases, where children now, they look like they are swollen, but it will be a way of the body managing the deficiency in the nutrients, where we have fluid accumulating in the child's body. At times we now see what is known as kwashiorkor cases rising in the community. Also the issue of micronutrient deficiencies, where we now see children, the issues of apathy, fatigue, dry skin, the immunity being compromised, so there will be repeated infections. These are a group of deficiencies or symptoms that we see after micronutrient deficiencies, where the body is lacking, be it vitamin A-rich foods like our orange-fleshed vegetables, or even our fruits, where the vitamin C is lacking, and at times where protein is lacking. So we start to see an imaging of some of the conditions, and even for adults, pellagra might start to show again. So again, it's an issue of say how best now can we prevent some of these conditions from rising, so that we preserve nutritional status and not even lose lives. But at times, we might even lose life because there will be no adequate, nutritious, safe food for our children and vulnerable populations.
At the third International Conference on Public Health in Africa Summit convened in Zambia in November of 2023, the Africa Center for Disease Control Director General Dr. Jean Kaseya stated, on average, Africa has 2 new outbreaks per week, totaling more than 100 outbreaks per year. 75% of these outbreaks are zoonotic in origin and worsened by climate change. The regional health arm has tied the worst outbreak of cholera in southern Africa in 3 years to climate change, saying adverse weather is raising the risk of this disease faster than in the rest of the world. Climate change is now a crisis acknowledged by leaders in southern Africa.
We must recognize the urgency of our response and the need for coordinated and efficient action, as cholera knows no borders and requires a regional approach to face it.
UNICEF says more than 200,000 cases and over 3,000 deaths have been reported in southern Africa since the start of 2023. Destala Q is the Group Partnership and External Affairs Director at the Arm of Health. She says climate change has become a danger for the survival of children in Africa.
Droughts, we have flooding, we have earthquakes, we have major climate conditions that are impacting directly either in deaths or directly either in agriculture, either in health, number of vector-borne diseases going up, malaria, all of those things coming up. Those are direct impacts of climate change.
A 2023 World Malaria Report released by the World Health Organization on the 30th of November 2023 spotlights the growing threat of climate change by showing the nexus between climate change and malaria. It says changes in temperature, humidity, and rainfall can influence the behavior and survival of the malaria-carrying Anopheles mosquito. Malaria patterns in Zimbabwe are already showing a worrying trend. In the first 8 months of 2023, 144,508 positive malaria cases were reported, according to official information by the Ministry of Health and Child Care.
We have been disproportionately affected with malaria, where we recorded over 16,000 cases last year and we recorded 11 deaths. Climate change has really affected us in terms of increasing water breeding sites where malaria is more prone, and we have also been affected with cholera again, where we've recorded more than 60 cases.
Among some of the emerging risks are issues of transactional sex involving young girls.
Poverty comes kind of disempowerment. So when you're poor, your negotiation skills are taken away. So let's look at a young girl who's probably 14, 15 in the rural area. There's this family that is saying, we can give your family a cow, or we can give your family 10 bags of maize. That girl does not have any negotiation power. Their assertive skills are actually absent. They cannot negotiate for any, even safe sex. So that's why we talk about poverty being one of the drivers for HIV and even child marriages, because now sometimes you're even a second, a third, or a fourth wife to someone because they have resources that your family needs, and now they want to use that against your family.
UNICEF is sounding the alarm on a looming climate-induced humanitarian crisis in Eastern and Southern Africa, where the lives of 45 million children are at risk of poor health, malnutrition, displacement, and learning loss. Zambia, Mozambique, Malawi, and Zimbabwe are ranked among countries where children are most at risk. The World Health Organization has underlined the emerging challenges as a catastrophe for humanity.
We do tend to see increases in children because they're the school-age children, and in the Northern Hemisphere, we're entering it's the autumn already, and we're entering the winter months. So we are expecting to see increases in acute respiratory infections. Mycoplasma pneumonia is not a reportable disease to WHO, so we tend to track this information through reporting systems and through discussions with our member states.
El Nino and the climate crisis have taken a terrible toll on many parts of East Africa. We've just seen a barrage of climate shocks. Here in Somalia, the levels of hunger are some of the worst we've seen in 10 years as deadly floods sweep the country, devastating families who were already food insecure, who have been struggling to recover from the longest drought in the country's recorded history.
Morbidity and mortality from yellow fever and other waterborne climate-sensitive diseases will likely rise because of climate change.
We're facing very real and increasing climate crisis in Southern Africa. Not only in Southern Africa, but I would say on the continent and even globally. And it is time now for real action, for people to put all those promises they made, even at the just concluded COP28, into action on the ground. El Nino could not have come at a worse time. It is affecting countries like Lesotho, Mozambique, Zimbabwe, Madagascar, Malawi, and even Zambia. So all the countries in the SADC region are having to contend with the El Nino phenomenon.
And the effect of the climate change are also increasing in scale every year. Disasters such as drought, heat wave, heavy rain, and floods have become apparent in the countries around the world. Zimbabwe has not been spared either with drought and mid-season dry spells, becoming more frequent. And this year, we are experiencing an El Nino drought. This project will provide food assistance to approximately 40,000 people in the arid areas.
Despite these vulnerabilities, children have been ignored in the response to climate change, with available data from UNICEF showing only 2.4% of climate finance from key multilateral climate funds are used to support projects incorporating child-responsive activities. The global call is for enhanced attention on climate change financing on children, with actions that focus on the care of mothers, newborns, and children. Now more than ever, attention to advocacy on climate change impacts in the healthcare system, especially focusing on children, is needed to safeguard their livelihoods and secure their future.